पेशेंट का काउंट है
स्क्रिप्ट था ना
जैसे मेल कर रहे हैं कि क्या कर रहे हैं? मेल कर रहे हैं ना, तो मेल करेंगे तो अपने इसमें सिस्टम में लॉगिन है ना, यहाँ से डाउनलोड कर लीजिए।
तो वो तो ऐसे ग्रेजुएशन से मेल कर रही है वो उधर लॉगिन है ना वैसे वहाँ पे ओपन है उसमें देखो आप अरे
ये देखो भाई 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 ये पीपीटी है
ये वो वहाँ से शेयर होगा ना
अरे ये और ये सही है शेयर कर दूँ
यहाँ से पीपीटी है रही क्या
डिस्प्ले पे बोल रहा हूँ
डिस्प्ले पे कर दे स्टार्ट कर सोचने वाली बात ही नहीं फुल स्क्रीन कर दे और स्ट्रीम तो हमारा स्टार्ट कर
ये पॉइंट है।
उसका माउस तो वो माइक को ने तुम दोनों में से कोई बोलेगा ना तो माइक को ना मैम को दे देना ठीक है मैम को बोला कि
मैं सुन रहा हूँ मैं चाहता हूँ सब स्क्रीन में सब आवाज आ रही
ये ना
ये कॉलर माइक है, लगा दीजिएगा जरूरत पड़ा।
ये वाला
है इसकी जरूरत नहीं है इसकी
हाँ उसे
वो साइड चेंज करना है
क्या हुआ
सही
क्या हुआ
इसको इधर
अच्छा
चार्जिंग को लगा दो
afternoon, everyone. I am Rishabh Ranjan Jha from the 5th semester Department of Biomedical Engineering.
I am Kashish Agrawal from Architecture Department, 5th semester.
We warmly welcome you to another iTalk session of 2025 organized by Innovation Cell NIT Raipur, and this time in collaboration with MEDEX, the Biomedical Engineering Association of NIT Raipur. We are excited to host today's session with an inspiring personality and a proud alumna of our own institute.
Of course, yes indeed. Today we are honored to welcome Dr.Megha Agrawal, who completed her BTech in Biomedical Engineering from NIT Raipur from the batch of 2007. And after that she went on to do her MTech from IIT Bombay and then a PhD from the University of Cambridge in 2000 in the field of ultrasound sensors. And she also worked in an intern for Stanford Bio's Center for Biodesign in 2011.
Currently, Dr. Megha is Adjunct Professor at the Luxembourg School of Business. She has over 14 years of experience as an R&D leader, innovation strategist across global institutions, startups, and medical research organizations. She is passionate about healthcare innovations, mentoring young innovators, and of course, like problem solving.
So, in our today's iTalk session, Dr. Megha will share with us her journey, the challenges and the opportunities in different innovation, and how young minds can shape the future with creativity and vision.
But before that, let us start the session with our tradition of welcoming our guest with a sapling. So I would like to invite Dr. Neelam Shobha Nirala to welcome ma'am with a sapling.
It's a full circle because she is my friend from India.
Yes, from the same batch.
Yes.
So, thank you so much. And now, without any further delay, we'll invite Megha ma'am to start with our session.
Thank you so much.
Thank you very much.
Good afternoon, everybody. How are you all doing? Good. Please take your seats. I'm so sorry that we are a bit late. There were some changes in our scheduling. Thanks for waiting. So, sometimes I think मैं हिंदी और इंग्लिश दोनों में बोलूँगी. Is that okay with everybody? Yeah. I think हिंदी में ज़्यादा बोलूँगी than English. So before we start the session, I wanted to set the tone. This is not going to be a monologue. Of course, I have some slides. Generally, I take this workshop. It is either a few hours long, half a day long, and we can do it for one day also. But I'll give you a flavor of many things. And what I wanted to do, and I told Dr. Saurabh Gupta as well, what I wanted to do is to have interaction with all of you. मैं कभी यहाँ बैठती थी, not so long ago, and I want to know what your feelings are, what your fears are, what your aspirations are, and hopefully with one amongst you had sent me a LinkedIn message yesterday. तो बोलते हैं कि we are excited to see you and have you discuss about the roadmap and career journey and all. तो मैंने उसको साफ-साफ बोला, this is not going to be a roadmap. This is not going to be. I'm no one to give any roadmap to anybody. So that's not the intention of this. So it's better to tell you what it is not than what it is. So I'm going to tell you a few things that I've learned along the way. So I'm going to give you a few snapshots about the different institutes that I have worked with and different learnings. Some things which has probably shaped the way I think about things and the way I solve problems. And also, if you think there's some nuggets of wisdom, please feel free to take or reject whatever doesn't suit you. So, with that in mind, please feel free to raise your hands anytime between the presentation, because as I said, let's have a dialogue, not a monologue. Okay. So, should I change? You can also go and sit down if this works. So before, maybe you have next slide. So before even we start with things, I want to extend a personal warm welcome to all of you. Next week, actually, in a coming few days, I am as one of the co-directors of this Asia Pacific Biodesign Innovation Summit. It's a conglomerate of Stanford Biodesign and Biodesign centers from the Asia Pacific region. All of us are meeting. It's the 10th anniversary of this conference. It's happening in Hyderabad this year. And for the next 4 years, actually, it will be hosted between Bharat Biodesign in India and Israel Biodesign. So next year it will be in Israel, and to 2027 it will be again in Bharat. We don't know the venue yet. And so basically what it is, it's bright minds in health tech and innovation coming all together. Many leaders from Singapore Biodesign, Australia Biodesign, Taipei, Japan, Israel, and all of us, and including so many centers in India, all of us come together to think about the future and what we have learned over the years and how this evolves over the years, the medtech innovation space. So in that, the Sunday, which is next week on the 24th of August, we have an open day, showcase day, where some of you, including Dr. Saurabh Gupta, and some of you students are coming. And if you I will share with Saurabh the agenda of the day. You can find it online and even on LinkedIn. If you find it interesting, it's my personal welcome to all of you. You can connect with me directly and you can see what we can do to make your visit worthwhile. Okay, so the full day on the 24th, you will see the Chief Minister of Telangana coming and many more dignitaries speaking on the stage, and it's a great opportunity to learn from the leaders and interact. So, with that in mind, we can go to the next slide, please. Okay, so I thought before we start, let's sort of exercise our creative muscles. I've brought my almost 7-year-old daughter with me. You might see on this side is quite self-evident. If you see something from different angles, people can perceive it differently. You must have heard about the elephant with the tail and with the trunk. अलग-अलग लोग अलग-अलग बारे में सोचते हैं. But this was one question that I asked my daughter, and she gave a very interesting answer. And I would like to hear from you. What do you think? So, अगर मैं पूछूं what is the color of an apple, what comes to your mind? Please. So I hear a lot of red. That's good. What else? Green. Yeah, green. What else? Brown. If it goes bad, yes, brown also. And white. White. Very good. Anybody else thought white? Why did you say? Yeah, you thought white. Why did you say white? Inside. Yes. Good. So probably the more part of the apple is always white, isn't it? So this was the answer given to me by my daughter. She said the color of an apple is white. I don't know why she thought. I don't know if she thought it because sometimes at that time when she was 4, I used to peel off the skin. But that gave me an idea that people can think of something so basic as an apple for different colors and things like probably association. So with that in mind, that was just a warm-up, but I wanted to focus the overall thinking into this bucket called strategic thinking. How many of you have heard the word strategic thinking before? Okay, some of us. So it's a good idea to know हम लोग सब करते हैं. Strategic thinking हर कोई इंसान everyday decision making में हर कोई करता है. Just उसको अगर हम properly एक framework में करें, that gives you different results. So there are various ways of looking at strategic thinking. There are few basic elements. But whenever you are making a decision or thinking about an innovation also, or managing a program, even thinking about your life decisions, at every step there are few buckets. You can anticipate what's happening, you can think critically about it, you can interpret the data that you have, you can gather more data, then you can make a decision, you can align, you can learn, you can then anticipate again. So everything is like a cycle, but it's not like one after the other. Go ahead. And there are different types of strategic thinking, and there are different ways where you can think about strategic thinking. So this picture is self-evident in terms of the types of insights and the depth of insights. So there are a few names that are given to strategic thinkers, and at different points of time you use different depths of strategic thinking, depending on the need and depending on the case. We can go, and what I wanted to do is not show so many slides, but save some time for our interaction. So we can go to the next slide. when we are thinking of strategic thinking, there are maybe we have to boil it down to three things that would be action, acumen, and allocation. And when we are thinking about these other resources, that could be different constraints like time, talent, budget, resources, feasibility. So these are few of the factors that you in the innovation ecosystem might be thinking of already. So with that introduction in mind, I thought I can take a poll here. Now the next few slides I can show you some parts of my story, or we can go ahead. So who wants to listen to some of my work and stories? Okay, so there are many. So we can go to the next slide, please. Okay, so this picture is from my research at IIT Bombay when I was in MTech. And incidentally, I just learned yesterday. Nowadays, GATE में biomedical हो गया start. That's amazing. In 2006-7, I went to go through EC, but that's great. So this work was, you can look at the paper later, but what I wanted to just point out, this work was about a hard-cold closure device, mechanical study of the device, mechanical testing of biomedical materials. That was the journal where this was published. But जब मैं ये experiment कर रही थी ना अपने lab में, तो theoretically तो सब पता था कि I wanted to see the capillary में कितना pressure होता है, उतना आना चाहिए, the reading should look like that. So theoretically सब लग रहा था कि it should work, but experimentally, like in real life, it was not working. And I tried everything, but at that time I couldn't figure out क्यों नहीं चल रहा है. Then one day it's a funny story, but what I want you to see is ideas can strike at any moment and at any time. So when I was having a break time, I was painting my nails actually. तो मैंने देखा कि जो नेल पेंट रिमूवर की जो बॉटल होती है उसमें स्नैप फिट होता है. किसी ने अगर ऑब्जर्व किया होगा उसमें अल्कोहल होता है तो they put it as a snap fit. And that time it struck me कि this cap that I have in my system here and here were actually threaded and it was not snap fit. So what was happening, the water from this was actually going into the threads and it was affecting the reading. And I ignored that part. And then I took a snap fit wala cap and it started to work perfectly. And it took some time, but then it started to work perfectly, so much so that I have 2 papers from this work as well as a patent in those 9 months of work at IIT Bombay. So from zero, it could lead to something. Next slide, please. That's the name of the paper. Please go ahead. Then this is the second part. It was in University of Cambridge. So basically, in my PhD, I was studying the mechanical characteristics of material using ultrasound. So not many people had done this before, and I'll show you one more example from that time. So I made this, again, it was a water bath aquarium type of structure that I started from scratch in my lab. And these two are the ultrasound transducers. One was emitter, one was receiver. And at that time, I wasn't sure like what to do. So then I found a few scrap metal plates in my workshop, and then I thought कि उनके बीच में डाल के देखते हैं कि क्या होता है. And to my surprise, it was consistent to give a signature of the material. This was not initially planned that this would be the part of my study, but it was so consistent and it gave us acoustic signature that I decided to test it for different materials, different alloys, polymers, and so on. And that's one of the work that was published. But it was just thinking about something in a very different way. So here's the place. Next, please. You can go ahead. I already explained. This was the paper that was published. Next, please. And so I wasn't sure if I should include it, but I treat all of you like my family and friends. So this is another way where I thought कि कहाँ से ideas strike होता है. So it was around the mid part of my PhD. I had posted this picture of me and my husband. And next slide. I saw that one of my teachers, and he's an English teacher. If you see in the circle, Dr. Shamala Naidu. He is my teacher from I think from the college time in English. Not here, but separate. So he wrote The Beauty and the Bard. It's good, I felt good, but I wasn't sure really what bard means. English में पता है, but still I googled it. So when I googled it, I found something like broadband acoustic. I've written it there. Broadband acoustic resonance dissolution spectroscopy. When I found that and I went deeper and deeper into it, I thought कि ये तो मेरे experiment में use हो सकता है, क्योंकि broadband acoustic spectroscopy ही मैं कर रही हूँ. And then I found a lab in Cambridge, जिनके पास ये I think it was material science or metallurgy department. They had this instrument. So I collaborated with them. I took some metallic classes and studied it with my system and their system and compared it. And finally, that was also next slide. It led to another experiment. That's a picture of that, and it was selected as one of the top student finalists at one of the IEEE conferences. But I'm just trying to show you some glimpses. Obviously, this is not a roadmap. Everybody is different, and everybody can have different times when ideas can strike. Next slide. Here I'm showing you a part of my work where we were an interdisciplinary team at Stanford India Biodesign. So you might know about that. We can separately chat again about that. And what it means is bringing different minds together in the same room, tackling the same problem and thinking about it differently. You all must have done it कि जब हम brainstorming करते हैं तो mind mapping करते हैं या हम सोचते हैं कि सब कुछ. So again, when this is the one important rule. If you want to take away one key thing today, is whenever you are thinking or brainstorming, don't limit yourself, don't constrain yourself, don't be your own censor, don't be your own judge. When we are brainstorming, at that time, go for quantity rather than quality, and don't think about कि इसमें क्या-क्या problems हो सकती है. That will come later. But when you are brainstorming, so this is an idea where in Stanford Biodesign we were doing this. We found this unmet need about finding the veins of people. Specifically pediatric oncology, जो बच्चों जिनको कैंसर हो जाता है उनको बार-बार blood draw करना पड़ता है और उनका vein easily accessible नहीं होता है. This is a clinical need that we observed many times, and we thought this is the most important need that we wanted to work on as a team. So this is an analogy that we said कि जब हम रोड पे पाइप्स नीचे हैं, कहाँ से जमीन खुलते हैं, तो ऐसे analogy को लेके we started doing some brainstorming. This is a mind map of that. We can quickly go to the next slide. This is another one where we said India में कैसे होता है, बाहर कैसे होता है, versus what's the procedure. So when you're brainstorming, first you'll do like free flow में जितना भी brainstorming करोगे ideas को, you put it on the table. But sometimes you can even say कि आज सिर्फ हम इस topic पे brainstorm करेंगे. फिर बाद में जब बहुत सारे ideas हो जाएंगे तो you can bucket them together and you can work around it. Maybe one thing will lead to the other, and there will be just one junction point after which things might become much more clearer, and maybe that's your aha moment. So it's very important कि जब हम शुरू में decide करते हैं कि हमें कुछ problem करना है solve, you don't jump into the solution as it is. Okay, so that's the next part I'll show you. This is the innovation process as I learned from the Stanford Biodesign program. So there are 3 steps in Stanford Biodesign innovation process. We call it simply the 3 I's. First one is identify. The second one is invent, and the third one is implement. And in that order. So first step, you identify. Like I said, in that step, you observe, you go to the field, you talk to the people, and you just observe like a fly on the wall. Fly on the wall, क्या करती है? It's just there and observes whatever is happening in the world around. You make notes. You observe what probably people are saying, thinking, feeling, not saying, read between the lines, and so on. So you come up with a long list of observations. With those long list of observations comes the needs statement. And there's a specific way to do it. You will find resources freely available on YouTube and so on. Especially if you can look at Professor Anurag Mehral, who is our alumni from NIT Raipur as well, and he is the director at Stanford Biodesign and Global Outreach. He has a lot of talks that you can follow to step by step follow this process. So once you have all the observations, you specifically make a need statement which addresses that particular unmet need. Once you have a long list of need statements, then you have a step of need screening. And you can see there are these feedback loops. So these steps can be actually a bit iterative. It doesn't matter if you want to come back at this step again to needs finding. Then the second one is invent. Only after you have identified from all the set of needs as a team that this is the need, after the needs filtering, you come up with a few needs, probably 2 or 3 out of maybe 200-300 here. You can come up with 2 or 3 needs that you have identified, and there's a way to do it. There's a process to it. You can come up with a few needs, and then either you can come at this point you can decide as a team or even individually to just work on that one or the 3 of them parallelly. So only after this step do you want to think about concepts and implementation. Okay, so this is a very important and different way of thinking. It's called solution agnostic. Matlab, don't think about the solution at all at this step, okay? Because that will bias your thinking. And some other time, if you want, we can do a little bit of a workshop interaction on that. I did not put those slides, but when I have students with me, we can break out into groups and see how, if you think about a solution, something can completely change the way innovation is going to work. Okay, so after this step, you have a few concepts, you generate those concepts, you will think about each of them. You maybe want to prototype it, you want to sketch it out, you want to develop something, whatever the concept is. Then you screen those concepts, then you think about the implementation. And this is just a snapshot in short, where in implementation there could be strategy development, business planning and so on. But there are, if you go next slide, I have some of them, but if you search anywhere on the internet, as well as there is a book, Biodesign, by Professor Paul York and Josh McCower. You can look at those details. So I don't think we should spend more time on this, but go ahead. Now this is the second part where I bring about some things which might be interesting for you as an audience. Please give me a time check at 30 minutes. Huh? Okay. So, actually, who all have heard of Maslow's pyramid here? Anybody else? So later you go and check. Few of us have seen it, but basically it's a like psychology concept. But this is the beauty of learning from different disciplines. You will learn about it. I'll not go so much in detail, but basically it says what are your basic needs. Then how do you go up the pyramid? The goal, as Dr. Abraham Maslow, he suggested that the goal of all of us, कि हमारा purpose क्या है इस धरती पे आने का? The goal of all of us is to go towards self-actualization. What is self-actualization? And you'll find it interesting that creativity, problem solving, lack of prejudice, spontaneity, all this comes also under self-actualization. If you search about it, you'll find various versions or various ways of interpreting this pyramid, and it's up to you how you choose to do it. Okay. So one part of it is motivation, and all of us in our day-to-day as well as in our career, we struggle with it, or we find sometimes we are too motivated, sometimes we maybe not. So there's one interesting book, and if you find a chance, please do read it. It's called Drive by Daniel Pink. I follow him a lot, and he suggests that there's a simple formula for motivation. If you have autonomy and mastery and purpose, the 3 ingredients, you will have automatically the motivation. And there are 2 types of motivation broadly, intrinsic and extrinsic. And the drive says it's all about intrinsic motivation. अगर आपको अंदर से किसी चीज को करने की चाहत आएगी ना, तब वो चीज हो जाती है. So next, maybe we can. So I said about it. Next slide, please. Next also. So this is another way of looking at the Maslow's pyramid for employees, but you will find it interesting. Okay. So then there you think about exactly what drives you, what types of intrinsic motivation. So you try to up your mastery, your autonomy and purpose, and then it will leave you with less fear and more drive as such to do the work. Thank you. Now, I have some of the slides where rather than looking at it together, might I might share it with you. But what's the time? How much time do I have? Yeah. Okay. We can go to the next. I'll show some of the action item things. Can I? Yeah. Okay. So I thought I'll give you some key takeaways. And you can either read it through later on about thinking about how do you work best. You think about there are actually many more tools nowadays. I'll give you these slides, some of them, to think about it. I wanted to just quickly go through a few of the slides. Yes, let's go ahead. Go ahead. Go ahead. Go ahead. As I said, different ways of looking at things. Like stereographic vision, if you have. Next slide. I also solved the Rubik's Cube, and that gave me a different perspective about thinking things. Here also I'll give you the slide. So I wanted to say that how you can develop your strategic thinking, your creative thinking. These slides are sort of self-explanatory, but there is a game. Let me tell you one game. One way to think about your creativity is, in the morning when you wake up, think about 3 random words. Okay, those 3 words should not be interrelated. And then the next morning, think about 3 more words. So there are these different brain gymming exercises. One day you will think about many different words and you'll try to find a common theme amongst them. So not only about your own core problem that you're solving, but trying to keep your mind off it and thinking about it. So there are some tips like that in my slides that I can share. But in the interest of time, because I want to interact with all of you, I want to skip through the slides. Go ahead. Here, yeah, go. Yeah. So since the last year, probably more than a year now, so Professor Anurag Mehral from Stanford Biodesign and I were talking. He has already been engaging all over the world, especially also in India, about creating different biodesign programs. In that, he has been talking to leaders and ministers in Chhattisgarh as well. And I joined all these brilliant leaders about 1.5 years ago. And we're trying to bring together different institutes and work to create a Chhattisgarh biodesign program. And that's one of those ages under which some of you will join us in the conference next week. And what we were trying to do, maybe some of you know about it, but we've had about 3 to 4 roundtable conferences where we brought leaders from IIM Raipur, NIT Raipur, IIT Bhilai, AIMS Raipur, ministers like the health ministry and so on. And I have some pictures to show you, along with Stanford Biodesign Center, where we are putting not only putting an ecosystem that you already have in Chhattisgarh, but trying to facilitate it towards making it even more visible, even more scalable. And when you visit Stanford Biodesign's website, you will find 2 specific things that are happening. So of course, many of you know about the Innovation Fellowship, the India Fellowship, and so on. But there are 2 other programs where specifically Professor Mehral and Dr. Raj Doshi, they facilitate them. One is called Founders Forum, where seasoned or leaders who have startups who are scaling up their business in India or globally. Here they have roundtable conferences about them in closed room, and they get advice about their innovation and how to scale up and how to make it even better. And the other one is called Innovators Workbench, Innovators Garage, where even starting up, like emerging real starters in the innovation, they are also getting advice directly from these esteemed mentors from the Bay Area. So we can think about something like that in Chhattisgarh as well. And this is a snapshot of one of the conferences which was held here about 6 months ago. And NIT Raipur was graciously hosting us, where here you see some doctors from AIMS Raipur, we see our own faculty from NIT, there were people from IIT Bhilai and so on. So we are trying to bring different ideas together and see how we can all make it even better. So please go ahead. This was one of the other conferences where the Health Minister of Chhattisgarh participated. This was last year, and many of you had attended. Next slide, please. Here are now, these are a few slides that we can go through quickly, some snapshots of how privileged I have been. In Cambridge, I got to meet Professor Stephen Hawking. It was such a great moment for me, specifically because my father is a physicist and it was a dream come true for my family. Here is some snapshots about my life in Luxembourg right now. So when I am not mentoring or I'm not thinking about healthcare, I'm also passionate about education. So I teach at the School of Business there in Luxembourg. These are my master's students, these are my bachelor students last year's. And sometimes this was a snapshot of my, I was moderating a panel on alternative health therapies and so on. Next slide. Or I was pitching. One of the skills that if you can develop with whichever resources you can find, and if you want to reach out to me personally, is the art of storytelling. Is the art of actually distilling down a very complex idea into so simple things that even a 7-year-old can understand. So this was one of the awards that I won during at the time. My daughter, I was pregnant with my daughter, but again, in 3 minutes, in 2 minutes, if you can distill down your research into an idea, into a pitch which can make sense to the larger audience, that's one of the best skills that you can learn. So, talking in small sentences, in less but more effective, and that takes a lot of practice. It's easier said than done. And then here's some snapshots of my children, but I'm learning a lot from them. Next, to be curious and to observe and absorb like a child. So that's it from me. You can stop here, and now it's the open floor for us to interact and share any thoughts and feelings that you may have. Thank you.
You can freely ask any questions if you have.
Ma'am, my question is like, how can we practice like multitasking or something like at one point we are very curious to learn several things at the same time. So how can we practice that efficiently?
Do you have? No, we don't have something to write on. So I was sort of expecting this question, and I was discussing with my brother today morning as well. He's also an innovator. He has several patents, and that's exactly what I thought. कि पूछेंगे कि अगर बहुत सारे ideas हैं तो उसमें से हमें कैसे, how do we filter it down, right? So there are various ways to think about it. One of the very good resources, if you've not read it already, 7 Habits of Highly Effective Leaders. But exactly how, like, simply मैं समझाऊँ तो एक अगर हम किसी भी action, किसी भी idea को, चाहे कोई भी decision है, if you try to plot it on 2 axes, on the x-axis you put like what's the cost of doing this, and on the y-axis you put like what's the value. So you would have quickly 4 quadrants, and you'll see कि किसमें ज़्यादा value मिल रही है with less cost. That's one way of doing it. तो आपको दिख जाएगा कि कौन सा action में कितनी ज़्यादा value है. Or the other way of looking at it is also it's called Eisenhower matrix. That उसमें जिसमें बोलते हैं कि जैसे for example I have 100 things to do today. अब मैं उसमें से क्या करूँ आज, पहले क्या करूँ? So what is urgent and what is important? This is another way of thinking about the same thing, है ना? तो इस तरीके से जब हम filter down करेंगे तो कभी-कभी बहुत easily ideas दिख जाएंगे. कुछ ऐसी चीजें होंगी जो हमें करने में आसान है, but इसको कोई value नहीं हो रहा है. तो ऐसे करके हमें अपने thinking को थोड़ा structured way में, like you know, organize करना चाहिए. Thank you. When you ask a question, could you please tell me your name as well as your branch and everything? It will help me know you better. Who all are excited about the conference happening next week? Anybody else has the time to come to Hyderabad? Yeah? Please do. I mean, it's an open day, and of course, you know, you have to come to Hyderabad for it. But
Please.
Business.
हाँ बोलो.
We heard a lot about biodesign. We all are curious.
हाँ.
So this is a question from me, based on my students. So we heard a lot about biodesigns. People are working on it. But as a BTech student, I may not know what exactly happening over there. So unless until I know what is happening, how I will get connected with it. So if you could just keep
Sorry, I will. How if you don't know what's happening there, how will you
connect over there. So I just need a gist of what exactly you people are doing, so that we can get motivated and work and combine with you people.
Yeah, no, that's a very important one. And thankfully, in this day and age, many things are available like online. That's the beauty of biodesign, especially I've seen. They make most of their events open. So first thing, follow them on LinkedIn and YouTube and so on. So from there you will get to know like almost every month, if not twice a month, there are events which are open to all. Zoom पे होता है. So I attended from Europe, but you have to seek your timing कैसा होता है, but otherwise also it's recorded. So that's one way because they are also evolving. So up until a few years back, it was about medical devices innovation. It was mainly focused about technology. Now they have realized that technology is piece, but also policy making, implementation, impact, and so on is also a part of making the research or innovation come to fruition, to translation. So if you want to get inspired and want to get connected, that's first step, I would say. And then all these people are quite open also to connect on LinkedIn, even talk to you and so on. So that's one way. And the other way is actually really, as I said, there are so many workshops that you can see, follow, and apply it to your own problem. So you could think about having a session half a day or so, where everybody, like you give them or don't even give them a problem statement. They find a problem statement, work in groups. Working in groups gives different perspectives to the same problem. And as diverse as possible, the groups making it as diverse as possible. For example, even lawyers, artists, doctors and engineers, or industrial designer and political science person and physicist, like these things all, and हमारा जो like world is evolving so rapidly, everything will be interdisciplinary. It already is, isn't it? So at that time, like 2003, when we started, ours was the first batch of biomedical. That was still a new word, what is interdisciplinary. Now everything is mixing with each other. So why not use it for our benefit and about learning from each other, absorbing. That's why I said that let's try to observe and absorb like a sponge. And I say this always in my talks that let's all be SpongeBobs, like the cartoon character, and Sponge Babes. Yeah.
Do you need any invitation to join that?
No, it's open. It's open like YouTube pe there's a lot. And then if there's a Zoom webinar happening, you just have to register with your email ID and so on.
And this upcoming
There should be. There should be. I don't have it on top of my mind, but basically the session starts on 1st of August. So there will be a few equity talks and so on going on. Maybe the limit might be 100 online, but I've never had a problem. So good to join. People are being shy today. No other questions, so I can go.
Ma'am, I have a very small question.
Please.
Because nowadays I have seen that artificial intelligence is in quite hype nowadays.
Yeah.
And I think its integration in biodesign might lead to some areas which were not seen before.
Yeah.
And like that. So, have you also thought in this field and are working on anything like that? And is this the right time for us as students to go in this field and develop more knowledge and learn about this?
Sure. It's a small question but a very pertinent one, and actually the apt one to ask. So artificial intelligence is going to affect all of us. It is affecting all of us, and it's better to ride the wave than to be fearful of it.
As such, I'm interested. I have not started working on it yet, but I'm collaborating and I'm working closely with Professor Meral as well as others in Luxembourg who are working in this field in different ways. So far, as we do research, we've done mainly data analysis or data interpretation. Now, artificial intelligence would be a bigger part of it, where you gather so much more. There are so many different factors to consider, but of course, if you start putting these pieces together, it is going to affect a lot of different things. So I would encourage you to study as much as possible, learn from resources, do some structured courses and so on, and really think about those things. And it comes down again, so it's a tool. Like just say, we have this toolkit, अगर कुछ टूट जाता है तो we take out one thing that we need. So treat it like a tool. Don't think that उसी में सब answers मिल जाएंगे. But the human intelligence part is the most important one when you are using these tools. So, of course, artificial intelligence and other tools you should learn. The other part which is not so talked about when you have to use a tool is probably emotional intelligence. Emotional intelligence are the soft skills about, and I think innovation, one of the most important ingredients of innovation is to have that power of emotional intelligence. Some of the things that constitute emotional intelligence are active listening, which is more uncommon than common. हम लोग जब भी बात करते हैं तो probably we think about what to answer or what to ask next, then really sitting down. जब तक हम जैसे हम first step बताया ना, like to find a need, you really have to go and see or observe. जब आप observe कर रहे हो, you cannot have any biases or cannot think about something else, which is so important because another aspect of emotional intelligence which we should all develop as people is empathy. What is empathy? Putting yourself in someone else's shoes and trying to think, feel, act like them. So, जब तक हम वो कर नहीं पाएंगे और अपने बारे में सोचेंगे तो we cannot think about what really the unmet need can be. So, these are all tools. As much as, so life is a journey of work in progress. As much as we can develop it, it might help us in having that impact in the world that we were born to give.
I think you can also tell them about like what will be the long-term benefits of connecting with Bharat Biodesign. Students are working in health.
Yeah. So Bharat Biodesign is a relatively new place where people from, specifically right now, they are based out of Hyderabad, where we are looking, aiming at an ecosystem where we will develop health technologies and bring different thought leaders together. The aim is to really have no silos. Have you heard of the word silos? Basically, एक room पे बैठ के अपना काम कर रहे हैं, वैसे innovation नहीं होता है. As much as we interact and make it reverse osmosis, so this is one of the platforms where we are trying to bring everyone together and learn from each other. So in a nutshell, that's the aim. Yeah. Any other question?
Good afternoon, ma'am. I'm Anshika from Biotechnology Department.
Yeah.
So, ma'am, I wanted to ask that what are the career opportunities in biotechnology and biomedical engineering field in India as well as the abroad, and like a little bit of comparative ideas I want to know. And if I want to make a career in this field of biomedical engineering and biotech, so what are the things which we have to keep in mind to do research here or to do research abroad? So how to differentiate that?
Thanks, Anshika, for that question. And I was anticipating that some of you will ask me that question. Probably, again, I said, I'm not the best person to give you career opportunity options and so on. Things are evolving. What I can tell you, if you want to take away one key point, is no one else can give you an advice, but rather try to spend more time in like finding yourself. That's why I had a few slides and you can see it later. Trying to find what really motivates you, because there are the options and the possibilities are endless. You have to think about and know about what are the possibilities. For example, if you want to go for research, if you want to develop more into one particular area, if you want to go abroad, if you want to work in another industry, all that is possible. And you know, पहले ऐसा होता था कि एक काम करेंगे और उसी में आगे बढ़ेंगे. Nowadays, everybody is changing careers so fast. So it's about at that point with all the factors like जैसे हमने शुरू में कहा ना strategic thinking. Do that on yourself as well. What is the data that you have about yourself? तुम्हें क्या क्या पसंद है? तुम्हें क्या क्या नहीं पसंद है? तुम्हें क्या क्या लगता है कि इस अगर कोई geographical location तुम्हारा define हो गया कि शायद मुझे यहाँ ही रहना है, तो वहाँ पे क्या क्या possible है? फिर उन दोनों को मैप करके देखो. फिर next 3 years का plan बना लो and try to observe, try to approach that in that way. So एक मैं आंसर दूंगी ना वो सही भी नहीं होगा. So that's why I said I don't want to give anybody any roadmap, but I want to give you tools that you can use and it can change. For example, so this is one interesting data that we have. In this generation, from your generation to the next time that you retire, this generation will change career at least 17 times and maybe more. So what does it mean? अगर हमारा 30 years का अगर टाइम है तो एक करियर में हम 2-3 साल रहने वाले हैं और मे बी स्टिल कम भी, है ना? तो डोंट स्ट्रेस योरसेल्फ अबाउट कि ये जो आज डिसीजन ले लिया वो ही करना है. बिकॉज इन माय एक्सपीरियंस नाउ if you want to hear from my experience, I have come across a PhD student in the physics department who was studying quantum theory in photosynthesis in biology. ऐसे बहुत ही अलग अलग डिफरेंट है ना. कोई अगर एक आर्टिस्ट है वो पढ़ रहा है कि कंप्यूटर में कैसे करना है, या कोई लॉयर है थिंकिंग अबाउट लिंग्विस्टिक्स, कोई लाइक हिस्ट्री और लिटरेचर पढ़ा है. कैम्ब्रिज में तो ऐसे बहुत सारे लोग थे. So they are doing completely different things, but trying to pursue their passion. इसलिए I kept some slides about intrinsic motivation, the pyramid, and so on. So try to spend some time with yourself. You don't even have to do it alone. Take some feedback about your working style from your peers, from your family. There are things like 360-degree analysis of your. तो तुम्हें अपने बारे में और पता चलेगा. और आजकल तो बहुत सारी चीजें आप AI में कर सकते हो. Like if you put your interests down, if you put these are my fears, even that it can give you the कि आपको कहाँ पे improve करना चाहिए. अगर आपको कोई few people's profile जो तुम्हें लगता है कि this could be me in the future, or this is the job description I want to see, so try to match it with what you have, what are the gaps you have. इस तरीके से बहुत कुछ करोगे ना तो you'll find one day you'll find कि okay अभी ये decision सही लग रहा है. Strategic thinking. Put all the things together and make a decision. Thank you. Thank you.
Hello ma'am, I am Rishabh from
Yeah.
fifth semester biomedical.
Hi, Rishabh.
So I have one question, but this is not my personal question,
Huh.
but from all the biomedical engineering students,
Okay.
because as a student sometimes I know what students are thinking of.
Hmm.
So some people feel like in branches like CS and IT, they have one profit that whatever they are studying, they can hands-on at the same time. But in the branch like biomedical engineering, they find it difficult that how we can hands-on the same thing that we are studying in our BTech. So is it so? Am I true, or there is something means false in that?
You tell me. What do you
I
think?
think we can, but it's not means easily accessible, or there is not too much awareness from my side. But if you know something, that
So
you can share.
let's think openly about it, creatively about it. Aren't we all doing something about our health every day? We are. So we can get some data about our health, right? We can. COVID के टाइम पे कितना कुछ हमने सीखा. टेम्परेचर नापना है, SpO2 नापना है, टेस्ट करना है, मास्क पहनना. तो the generic statement, I don't agree to it that we can't do. There are so many things if you think creatively, we are doing so many things around us. And if you have elderly, if you have a blood pressure monitoring system at home, there are so many things that आजकल तो इतनी चीजें हो रही है. Like for even you wear a smartwatch or you measure some data of your own body, you can analyze that and you can get access. So वो जो CS वाले कर रहे हैं या फिर आप जो data analysis कर रहे हो वो आप भी अपने data पे खुद भी कर सकते हो. Who knows, you can come up with a breakthrough. AI, like the other student asked right now, how can we use AI? Already there could be few ideas. I think we can open it for open brainstorming also. But for example, if you take a picture of your meal every day, put it on, for example, chat GPT every day and say कि इसमें कितने calories है या मेरे को ये मेरा blood test report है, इसमें ये missing है और मैं रोज ये खाती हूँ तो सही खाती हूँ कि नहीं खाती हूँ. Maybe the data and training model is not so accurate right now. That you can work on. That those are the things that you can find. This is not up to the mark for this population, for Indian population, for Chhattisgarh population, whatever it is. But there are already so many things that you can put together to make a recipe, isn't it? So this is the part of creative thinking of all of it. So I don't want this batch of biomedical engineers to think that something is impossible. When we could do it, like we could think, it was a canteen year for that matter at that time.
Correct.
हाँ, हमारे पास तो कोई lab भी नहीं था, तो हमारे तो classes भी, it was supposed to be from IIT and all that live seminars होने थे, but वो सब भी इतना नहीं हुआ था. So this now you have so many more things, ना? So please, whoever is saying those rumors, stop it.
I'll just add to
Yeah.
it कि कोविड में तो हम सभी बायोमेडिकल इंजीनियर थे,
हाँ.
isn't it? घर में जिसको कुछ नहीं आता था वो भी अपना पल्स ऑक्सीमीटर का यूज कर ही रहा था, right? Ventilators we all know. So I think it all starts from human health only. Right?
Thank you.
So Rishabh is coming next week to Hyderabad, right? Yes. Who else is coming? Sir, other student. Are you on? Great. Thank you for coming. Anybody else? Oh, great. So I'll take a list of names there. Yeah.
Good afternoon, ma'am. I'm Adjunct. I'm from AIMS Raipur, second year.
Oh, great. Thanks for coming.
Thank you, ma'am. Ma'am, as I have tried some of the product to launch in the market and also to build some products, but as a medical student, I find the problem that I have to manage all the things, like from product making to selling it into the market. So, how can I manage all the things at a time?
Yeah, it's a big task. It's actually a problem. So the short answer to it is team. Try to have a team, and I think you've been given that advice already.
Yes, ma'am.
Yeah. जी, और तो तुम्हारे दुख से समझ में आ गया मुझे. But yes, not everybody can do everything. We can try to do most of the things, but then basically if you are saying yes to something, you are saying no to so many other things. So at the time that you could probably innovate, you have to do cost analysis or marketing and things like that. So ideally, things happen in a team, and different people take care of different activities. But in the meantime, in the beginning, for every institution, so like for example, I was heading a not-for-profit organization as the managing director in Luxembourg. I was as the managing director of this one based in a hospital where I had to manage the ministries and health institutes and sports ministry, education ministry, सबके साथ काम करना पड़ता था. I was incidentally the only non-European, and so at that time I did not speak the languages. Now I can speak in French and deal with them. I was thinking कि मैं कैसे करूँ, सब कुछ मैं कैसे करूँ? So make friends, make allies, try to make things work for you, and be open to the idea of accepting that everything won't be perfect. Everything will take time, and you're doing the best you can in that moment. Yeah.
Thank you so much, ma'am, for such a wonderful, inspiring and motivating session. We are so glad to have you with us today. And your words were truly inspiring, and it showed us how innovation is not about ideas, but to make an impact by working on it in our real life. So we are really great to have you here.
Thank you so much for inviting me. I had a blast as well.
Your journey from NIT Raipur to Cambridge and now mentoring the innovators is a source for inspiration for all of us.
So with this, we'll conclude our iTalk today. And we thank you everyone for joining us today here. And we look forward for more such events and sessions. And
Thank you, everybody.
Members of Innovation Cell and Medex will stay, and others can leave if you want.
Yes, Rajesh, the same thing. I want to attend your class.
Everyone in the hall can stay for a group photograph.
Yeah, please, everybody is invited for the photograph.
Hello.
आकाश जो बाहर हैं उनको बुला लो फोटोग्राफ
I need your
हो गया